Did you know that ophthalmologists have been performing corneal transplants since the early 1900s? And through the years, as microsurgical techniques have been refined, the operation has become a very predictable and highly successful sight-restoring procedure. Today, the procedure restores vision to more than 20,000 people each year. The cornea is a sort of window of the eye. Its clear, rounded tissue covers the front of the eye, including the colored portion known as the iris. The cornea works as a lens, bending and focusing light toward the retina at the back of the eye. The eye also has a natural lens, and both must be clear so light can pass through unobstructed. In the course of a lifetime, however, many things can interfere with proper functioning of the cornea. Some transplants replace corneas which have become cloudy after cataract surgery. In cataract surgery, the lens of the eye is removed because it's become cloudy or opaque. But sometimes after cataract surgery, the cornea becomes cloudy and must be replaced. The cornea can also become cloudy or scarred through injury and may require transplant to restore vision. Some corneal problems are hereditary. Keratoconus is a condition where the cornea becomes cone-shaped. Vision may be impaired, and corrective lenses may not be helpful. Corneal scarring may also result from infection of herpes or bacteria. The success rate of corneal transplantation is amazingly high, although success depends to a great extent on the type of disease or damage to the cornea. For example, in rare cases of certain types of chemical burns of the eye, corneal transplants may be only marginally successful. One reason corneal transplants are so successful is that human corneal tissue is one of the few tissues which can be transplanted with very little risk of rejection. And even if the patient does begin to reject the new cornea, the doctor can usually stop the rejection by simply treating the eye with special drops. Patients need to be aware of any signs of trouble after surgery. Pain, redness, increased sensitivity to light, and decreasing vision are all important signs of trouble that could appear. The patient who has these symptoms should call the doctor immediately. In the few cases where the donor cornea does not stay clear, the operation can nearly always be redone. The chances of success the second time around are virtually the same as for the first transplant. Barring rejection, poor healing, or injury, the new cornea should last a lifetime. The transplant procedure will be done by the doctor and a team of surgical assistants in a fully equipped operating suite. The surgery may be done as an inpatient or outpatient procedure. During the procedure, your surgeon skillfully removes the central two-thirds of the cornea and replaces it with the specially prepared donor cornea. The corneal transplant may be done under a local or general anesthetic. The procedure will take about an hour or more, but the total time the patient is in the operating area may be longer, especially if the transplant is being done in combination with another surgery, such as cataract removal. Although the surgery itself is virtually painless, the patient should expect some discomfort during the first 12 to 18 hours immediately afterwards. You should be aware, however, that as in any surgical procedure, the possibility of complications during and after surgery always exists. Such complications are infrequent and can usually be dealt with at the time of surgery. These complications include loss of vision, loss of eye, hemorrhage, infection, cystoid macular edema, retinal detachment, graft rejection, chronic inflammation, and astigmatism. If you would like additional information on this topic, please be sure to ask. After the surgery, the doctor will provide any pain medications, drops, or ointments that may be required during convalescence. There will also be special instructions and schedules which the patient should follow exactly. Most patients who have corneal transplants have very poor vision to begin with and understandably are quite anxious to know how well they might be able to see after the operation. The purpose of the transplant is to provide a clearer window for vision, so to speak. There is no way to predict exactly how sharp that vision will be, since so much depends on the individual healing characteristics of the patient's eye. But after the eye heals, glasses or contact lenses will almost surely be required to obtain the best vision. During the recovery period, the patients will be asked to wear old glasses or sunglasses during the day. Even though your glasses will not improve your vision during recovery, it is most important that you protect your eyes from accidental injury. Whenever the glasses are taken off, as in sleeping, bathing, washing your hair, and so forth, a protective shield should be worn. Today, corneal transplant surgery is a relatively common and very effective way to dramatically restore vision for tens of thousands of people.